Hi guys, so welcome to this webinar. In terms of low back pain, pretty straightforward. So, my name's Yetta. Nice to meet you all. So, in this webinar or maybe the presentation, before we start, I just want to kind of go through my background. So I studied my bachelor's back in 2023 in physiotherapy, and I got a first class honors where my dissertation, my proposal was written on low back pain. So yes, it is a proposal, but at the same time we have to go through some of the um, basically different systematic reviews, different researches, to do some critical thinking. So I've looked through some of the kind of low back pain studies and stuff. So pretty much a bit more familiarized around low back pain. I'm currently working in the NHS as an outpatient physiotherapist in a static position. Um, it's basically MSK, where I kind of manage different a variety of MSK conditions, seeing different variety of like upper limb, lower limb, even head problems, and given different management options as well. I'm currently self-employed as well in a private clinic working around Sheffield. My main role in there is again physiotherapy, a bit like sports massage, and also personal training. So if anyone wants to kind of wanted to be looked at, feel free and more than welcome to come around to my clinic in May to Move. Just click on the link in my bio, and then you'll find it on there to book the link in, or even just email me saying like I want to be booked at this time, this date. Are you able to do it for me? Perfect. And I'm also a huge gym enthusiast. I like to look around, studies, research, even just like literally anything related to gym. So in terms of like, I'm currently training for my bodybuilding. I had 3 years history of gym experiences. I know kind of like the anatomy, the muscle anatomy, bone anatomies and stuff, where I had a period I was kind of self-learning and put puzzles into pieces into kind of my gym regimen. Okay, so gone a bit of a tangent, but let's get back to the main bit, which is the low back pain bit. So, in terms of how common is low back pain? So, in terms of low back pain, up to 60% of the adult population will have low back pain at some point in their life. So, it is quite a common musculoskeletal condition where you could literally see, like from this data, um, that basically low back pain is like number one MSK condition that affects people's quality of life, their work, even just kind of normal functional daily movements. We do require our back, which in terms of our back is quite important. So obviously we would like to know why do we have it? So in terms of, we're just gonna split into two categories first. So in terms of their specific and non-specific low back pain, whereas we're gonna talk about more around non-specific low back pain first. In terms of non-specific low back pain, there's like 90% of low back pain cases which are classified as non-specific. There's like different risk factors around it. So because as it meant as like the word non-specific basically covers that there's not like a definite reason or a definite change that is affecting you having low back pain. But there are kind of different risk, there are kind of different, um, we would say like risk factors that affects your low back pain. So like um, a low physical activity, whereas you're working as a sedentary life, like you're having a sedentary lifestyle, you're more likely having a desk space role, you're sitting like a long time, not having breaks in between, and just kind of like walkings and stuff, where your back is being a bit deconditioned. So those types of stuff will kind of cause a bit more risk of having low back pain. Smoking, there is evidence showing that smoking kind of dehydrates the disc in terms of your lower back. Your lower back, which is called the spinal cord, there are kind of fluids that helps maintain that disc health, whereas smoking does affect some sort of the disc, to cause them having a bit more dehydration. In terms of obesity, it's just definitely physiological changes, because as we get a bit more heavier, our body. So in terms of your body, because you got a higher BMI or higher weight, you're carrying excessive body weight, where your lumbar spine, which is basically the lumbar L1 to L5 region, especially the L4 and 5 region, they carry the most weight in your lower back, and hence that's why that is kind of a common region where people have lower back pain. Um, in terms of, there are also different factors, not just physiological changes, but also um, if you have a bit more stress, it kind of increases your pain sensitivity. Um, if you have a bit more pain around in your back, it sends a bit more signals to your brain, and your brain is wanting to kind of protect you from that danger or that harm, as we are like we're like homeostasis in nature, and hence that's why you might find maybe you have a bit more stressful related events that are happening in your life that might kind of bit causing a bit more pain, and also psychosocial factors as well, and many more. Hence, that's why it's called non-specific low back pain. So there's no kind of one definite answer to having low back pain, but those are kind of the risk factors that might causing a bit more pain around your lower back. So in terms of specific low back pain, it's just mainly having like medical conditions, mainly tissue damage, whereas like you had a fall, you had a trauma, where it's causing fractures and stuff, or they're like being scanned by MRI, X-ray, where it shows there's some physiological changes, like fractures, disc herniations, and osteoarthritis, etc. In terms of maybe you've got some medical conditions like cancer, triple A's, they do kind of radiate pain going down to the back, where you might have a bit more pain. With those kind of conditions, it is worthwhile to seek medical attention or physiotherapist to kind of consult your basically to kind of consult and diagnose for further treatments and things like that. In terms of, so what we may experience, or like what are the symptoms? Main thing is definitely the pain. Some people, they might find there's some achiness, a bit of a sharpening at the back, uh, maybe some shooting pain going down to the leg or feet, what we so call like radicular pain. So uh, It's just basically referred pain due to kind of like irritation around the nerve. So in terms of like the pain, not just the pain itself, you might also find a bit like tingling numbness. Again, it could be again a nerve irritation, or even might have a bit of like compression around the nerve. Again, with all of these symptoms, it's best to seek for medical attention or a physiotherapist to be looked at, just to make sure things are on the right track and there's nothing sinister happening. Um, in terms of, you might find a bit stiff, just for example, if you got osteoarthritis in the back, as because you got narrow joint spaces around it, where kind of bending forwards, bending backwards of those movements causes a bit more pain. You might find you might find because I am afraid that I might damage something more. Hence, that's why you might find yourself in a bit more kind of static position, where because you remain static for a long time, your fluids around the back isn't kind of functioning well or moving well. Um, you're not getting the nutrients, you're not getting the fluid that it needs to be. And when you kind of start moving back again, you might find yourself a bit more stiff. Some people, they do kind of mention sleep disturbance because of the pain itself, rather than kind of sleep disturbance as like the main cause. Um, and also reduction in normal daily activities, like getting slower in your walking, find it hard to bending forwards, bending backwards and stuff as well. So obviously we've gone through like the symptoms, um, what type of low back pain do we experience, and why do we have low back pains and stuff. So the most important thing is definitely how do we manage it. So mainly in terms of, I would like to chop it down to three pieces, basically three stages, which is called um, acute, subacute, and chronic. So as you can see, acute is less than 6 weeks, uh, as in like from the initial onset from where you're experiencing low back pain. Subacute is just somewhere between 6 weeks to 3 months, and chronic is like a long-standing condition where we kind of define as more than 3 months. So based on the time frame and the present symptoms of your condition, there will be like slight difference in your management. But generally, the key to low back pain in all of the stages is to kind of strengthening and keeping your back mobile, to just basically helping it to heal, have a faster recovery in terms of the healing process and things like that. So um, mainly, always first line of treatment, we'll try to have a conservative management, so not going towards any kind of invasive treatment first. Um, it's not saying that we're trying to kind of block you away from getting that surgery access, and not trying to postpone you from having other treatments, but as evidence do suggest, where most low back pain cases can be managed conservatively. Hence, that's why we are trying to kind of giving out different sorts of conservative management, and also in a combination with education to help you understand your low back pain, understanding your condition. So there are some like generic management methods that we normally mention to patients or clients with low back pain. Try some heat or try some ice, as you can see on the icons. Maybe hot water bottle or weak back and wrapping around a towel. Maybe a frozen bag of peas, or maybe just like a small ice pack and things like that. You might find a massage gun or someone to help you to massage might be a bit beneficial in terms of managing your pain, as you might have a bit more muscle tension around your lower back due to the pain that you're experiencing. You could also see from the right bottom corner, it's called a TENS machine. So it's basically a machine that sends kind of electrical stimulation, which helps you to try to relieve the pain as like a short-term management um, through kind of the pain gate theory. So again, with all of these things, it's a combination with exercise as well. The last thing is the pain medication. Obviously, we are not trying to say, okay, you have to take it long term, but it's saying like um, some pain relief definitely is going to help you relieving some of the pain if you're experiencing inflammation around your back. So maybe anti-inflammatory drugs like ibuprofen, naproxen, things like that, which are prescribed by your GP or your pharmacist. Um, again, these are kind of like recommendations in terms of dealing with low back pain. In terms of pain medications, it is beneficial to speak to your GP or pharmacist around it, just because we are not medical professionals who prescribes any kind of drug medications. Okay, and but definitely the most important thing about low back pain is to keep yourself active. As you can see, uh, there are different kind of activities that you could go for if you really can't walk for long term. Maybe find some cycling classes or even just kind of cycling outside, outdoors. Might be a bit beneficial, as some people find symptoms might be a bit more aggravation when they're kind of bending backwards rather than bending forwards. So maybe perching on a bike, you might find a bit more beneficial. Uh, and also, um, if you like meditation, maybe meditation might be beneficial for you. It's just trying to find different activities to help out the symptoms of low back pain with a combination of different aerobic exercises and also strength training, as you can see from the left bottom corner. At the same time, we also would like you to look at some kind of diet management, weight management, if overweight is kind of the key risk factor that is causing lower back pain. So trying to kind of eat well and stuff where I do provide nutrition coaching as well. So again, if you're not too sure what things that you have to look out for in terms of low back pain, feel free to kind of drop me a message in my email. Okay, so hopefully by the end of this kind of session, you're able to kind of understand what is low back pain, understanding the symptoms of it and how it presents, and understand that low back pain is a quite common condition in musculoskeletal disorders or conditions. And understanding low back pain can be managed conservatively with different modifications in most times. And understanding the main key thing is it requires effort and time to resolve in the combination of strengthening and also kind of some rehab with the physiotherapist. Okay, and the last thing for today, as a little reward, basically in combination with this webinar, I've made a home-based exercise program. There are kind of like 3 different level of progressions or regressions based on your current condition. Okay, and so it will be attached to a link where you could find that exercise program. So I would suggest in terms of the exercise, definitely try from the lower end, so the early stage first, and then slowly building that tolerance up until you get to a point where you feel a bit comfortable, that you're able to push a bit more. Um, so just follow the link that will be attached to this webinar, and you'll find that program with a logbook as well, which comes with this webinar. Perfect. And thank you so much for listening to this webinar, watching this webinar. I know dealing with low back pain is not easy at all. It is very difficult, especially if you're not too sure about your own condition. You're not too sure if you're on the right track or if you're damaging anything, any structures. So if you do want to make sure that everything's okay around your back and you want to be looked at by a physio or a medical professional, as a thank you of kind of buying this webinar, I would like to give you 10% off when you would like to see me in clinic. So just basically show this slide by the end of the session. Sorry, when when you come up to the clinic, and I'll be able to give you a 10% off. So thank you very much for for buying this webinar. If you do have any questions, I'm more than happy to answer through email or via Instagram. I'll always be there, always be active. So yeah, peace out.